Episode 4. This episode focuses on friends and potential enemies of good health. We hope you enjoy listening. Healthy diets, moderate exercise and a health-friendly environment are necessary for adding healthy years to the lives of older adults. Professor Aikhoje. Introduction. We assume that as adults, we are aware of the things we must do to ensure healthy living. So, our concern here is to remind ourselves of these things and emphasize their importance in health management. Our friends are a balanced diet and eating habit, exercise, and our potential enemies are tobacco and alcohol. Diet and eating habit. Diet is defined as the sort of food eaten by a person, a group of people, or a community. Diets provide nutrition for the body, and nutrition has significant influence on all body processes, such as building up immunity, growth, and body function. There is a vast amount of literature on diets that promote good health and those that do not. Magazines show obese people eating junk foods, with remarks that in the process such people are digging their graves with their mouth. On the other hand, there are magazines that show healthier-looking people who are said to be on good diet. We note that the nutritional needs of the elderly are no less important than those of the other ages. In Nigeria, there are elegant terms in describing the choice of menu. At parties. Some of the terms are roll and swallow, or chew, roll and swallow types of food which refer, for example, to pounded yam, and amala or rice and fried plantain respectively. In many parts of the world, foods exist more in the form of chewing, rolling and swallowing. Foods in the form of rolling and swallowing are popular in Nigeria, as in other African countries. These types of foods are best eaten with plenty of leafy vegetables to provide a balanced diet. Nutrition experts talk about healthy diets for healthy living. They talk about diet for different locations and conditions. There has been, of recent, emphasis on fruits and vegetables. Living on a balanced diet means eating different kinds of foods without missing out on the essential elements required by the body. The components of diets are proteins, carbohydrates and fats, vitamins, minerals, fiber, and water. Proteins. Proteins are complex organic compounds and they derive from amino acids. Thus, amino acids are regarded as building blocks or Legos for building life. We are told that a total of 20 different kinds of amino acids form proteins, and some of these are termed essential amino acids for humans because they perform important hormone reaction in the body as well as such critical functions as the induction of normal sleep, reduction of anxiety and building strong immune system. Proteins are responsible for growth, repair and replacement of body tissues. They are involved in such functions as regulating the supply of energy to body tissues and controlling the absorption of calcium. A regular daily and adequate intake of protein is required for the performance of these functions. Proteins are available in different forms. These forms include meat, milk and other dairy products, grains, fruits and vegetables. How much protein the body needs depends on many factors, and it has been a subject of debate among nutritionists. For an adult, a daily intake of meat protein in the range of 60 to 80 grams is said to be adequate. Meat proteins are expensive and can be a luxury for the poor. For the rich, excess meat or flesh protein can be harmful because it may contain animal residue and other waste products that can impose an extra burden on the kidneys and other organs of elimination. There are relatively inexpensive foods that contain all the essential amino acids and therefore adequate protein. Such foods are said to be complete proteins. An example is beans. However, if one type of food lacks a certain amino acid, another may have it. This is why variety of food is necessary to achieve a balanced diet. There is also the debate about mixing starches and proteins. A small group of nutritionists advocate that the pounded yam is eaten now and the meat 1 hour after. A larger group would advise that both types of food should go together. We recall the story of eat the food now and drink water later, in which the middle position taken by Adegboyega Ketiku, a renowned professor of human nutrition, is drink water when you are thirsty. Without going into the merits and demerits of the preceding opinions, it is sufficient for us to say that we are not aware of any risks, based on the opinions, in adopting any particular approach to eating and drinking. Carbohydrates, fats and cholesterol. Carbohydrates are chemical compounds which contain carbon, hydrogen and oxygen. They are in the form of sugars and starchy foods considered to be fattening. Some of these foods are cereals, bread, yam, cassava, and potatoes. They constitute an important source of energy for the body. They also provide some other elements of a balanced diet such as protein and iron. Excessive intake of carbohydrate from sugary foods may result in building up much more calories than the body requires. People who do this may become fat and overweight. We know that food items such as yam and cassava contain high proportions of carbohydrates, but the sugar in them is low. Therefore, they do not constitute a source of overweight, especially if eaten with plenty of vegetables. Fats are white or yellow substances found mainly in animal bodies. They are oily or greasy. Oily substances or fats are also available from certain seeds. Fats provide calories for heat and energy, much more calories than can be obtained from carbohydrates. Small quantities of fats are used for growth and repair of body tissues. Fats also make food tasty and filling. Dietitians talk about two types of fat, the saturated, which tend to increase the amount of cholesterol in the blood, and the unsaturated, which is relatively harmless. Sources of fats include meat, egg yolk, milk, butter, vegetable oils, and nuts. Fats from animal sources are highly saturated and should be avoided. On the other hand, the fat in fish, chicken, and most vegetable oils is largely unsaturated and free from bad cholesterol problems. Fats from sunflower, corn, or soybean are best for good health. However, excess fat from any source can cause serious medical problems such as those that are related to diabetes, hypertension, and obesity. Cholesterol is defined as a fat-like substance found in blood, muscle, liver, brain, and other tissues in people and animals. Medical experts say that most of the cholesterol in our body is made in our liver, where some is synthesized, and some excreted in the bile. Cholesterol may also come from our diets. Cholesterol is carried through the bloodstream by lipoproteins, which are classified according to their density in the serum, the thin, transparent part of blood. Two classifications, the low-density lipoprotein, LDL, and the high-density lipoprotein, HDL, are of interest because the fractions of cholesterol in them are associated with heart diseases. They are the readings that doctors usually look at. The two major types of cholesterol, the bad cholesterol and the good cholesterol, are associated with LDL and HDL respectively. The body needs cholesterol to produce hormones and vitamin D, among other functions. However, if a body produces too much cholesterol, the excess stays in the blood vessels and may cause hardening of the arteries, leading to heart attack or stroke or other health problems. According to cardiologists, lowering the cholesterol level in cardiac patients reduces mortality, the reduction of risk being proportional to the reduction in LDL cholesterol and the increase in HDL cholesterol. In all of these, nutritionists and dietitians advise that a healthful, high-fiber diet with lots of fruits, vegetables, and nuts may decrease high cholesterol levels. Vitamins. Vitamins are organic substances which are essential to the health of man and animals. Many parts of the body need vitamin A for proper texture and functioning. For example, vitamin A helps to keep the skin smooth and clear. Vitamin A is also necessary for the normal growth of bones and teeth. Vitamin B is in the form of a complex of substances, each performing a specific function. Some form of vitamin B is needed in the transfer of energy within the cells, and others are necessary for the formation of red blood cells. Vitamin C is reputed for healing properties. Experts say that it is particularly important in maintaining the walls of the smaller blood vessels as well as in the absorption of iron from the digestive tract. Human beings can manufacture some vitamins for themselves, such as vitamin D from sunlight and vitamin K from bacterial action in the intestines. Other vitamins come from our foods. Severe or prolonged vitamin deficiency can lead to health problems. We know that one of the many important functions of vitamin A is related to vision. Without vitamin A, the eyes do not respond quickly to changes in lighting, say from daylight to darkness. There is thus a risk of vision impairment, especially at night. This is one reason why some elderly people do not drive at night. Also, it is believed that the mental confusion common in old people is often due to a low intake of vitamin B. If there is inadequate intake of vitamin C, hemorrhages may appear on the gums and around the teeth. This is probably a mild form of scurvy, a disease related to nutrition, and, like some other elderly people do, I suffer from it regularly. Still, on the elderly, some with fractured bones are found to be deficient in vitamin D. A word about how much vitamins the body requires. Too much vitamin A dries out the skin and enlarges the liver and the spleen. Too much D leads to excess calcium in the blood, which can cause certain gastrointestinal and nervous disorders. It is noted that there is no potential harm in taking too much of vitamin C. It is water-soluble and any surplus of it in the body is readily passed out in the urine. The one question of how much is best answered by the nutritionists. Minerals. Minerals are metals and salts, and they are necessary for proper body function. The most important minerals are iron, calcium, phosphorus, iodine and sodium chloride in the form of table salt. Insufficient intake of these minerals may lead to disorders. Consider iodine, for instance. Only a few grains are needed, but its absence could make the difference between a normal person and one who is a mental and physical dwarf. Calcium is said to be the most abundant mineral in the body, with about 99% of it in the bones and 1% busy circulating in the blood. From the point of heart health, the experts say that without sufficient calcium, the heart could not operate with smooth regular rhythm. Most of the iron in the body combines with hemoglobin, the protein element that produces the color in the red blood cells. Iron deficiency shows up in low red cells count. A low red cells count could be a sign of anemia, excess body fluid or blood loss. Anemia is a health condition in which the number of the red blood cells is greatly reduced, resulting in the thinning of the blood and insufficient supply of oxygen to the cells. Fiber and salt. Fiber provides the bulk or vehicle to help the large intestine in carrying away body wastes, thus providing protection against some diseases. On the other hand, salt is necessary to maintain the acid-base balance of the body. However, too much salt can be bad for us, especially those of us who suffer from high blood pressure. Water. Water is a household word. It is eulogized by a popular Nigerian artist, Anikulapo Kuti, as a friend of all and enemy to none, in the sense that everyone has need for it, not only for food but for general uses. Water is necessary for removing wastes from the body. It plays a role in maintaining the normal body temperature and in moistening the air we breathe. Many elderly people do not drink enough water, and as a result they may complain of fatigue and headache. Composition and types of a typical diet. We are told that a typical diet consists of 50% carbohydrates, 35 to 40% fats and 10 to 15% proteins. We are also told that 30% of our food is solid while the remaining 70% is water. It is the business of dietitians and nutrition experts to combine food components to achieve desired objectives such as weight control and management of health problems. For example, there are diets which are formulated to manage diabetes and other ailments. This brings to mind the dietary approach to stopping hypertension, DASH, diet which was pioneered by Dr. Tom Moore and which is popular in the US. According to Dr. Tom Moore, when the diet was first designed and tested, the goal was to create a diet that would lower blood pressure, and it did. It was claimed that the DASH diet had other benefits too. People lost weight, cholesterol went down, people felt better, more energized and alert. Some other benefits of the DASH diet were reported. The benefits include the prevention of heart attacks, strokes, heart failure, kidney stones, and colon cancer. We note that the diet's market in the developed countries is awash with mouthwatering claims. It is difficult to verify many of the claims. If the benefits of the diets are not obtained, the fault is put on the body system of the consumer. This is one reason why people move from one diet plan to another with the hope that they would eventually find the miracle diet. On the contrary, many poor people do not have enough food to eat, let alone being selective. In most cases, attention is paid to maintenance diet rather than growth or developmental diet. The definition of a diet as the food eaten by a community fits nicely into the Mediterranean region. We are told by experts that the Mediterranean diet consists of a large amount of whole grains, fruits and vegetables, nuts and legumes, fish, poultry with small amount of refined grains and red meat. There are reports that many community members of that region remain healthy to very old age. Concerned, in the main, with diets for graceful aging, the Mediterranean diet looks attractive for the inhabitants of other regions of the world. And, indeed, nutrition experts recommend highly modified Mediterranean diet for graceful aging. Certainly, the term eat plenty of fruits and vegetables has become very popular of recent. The choice of diet is yours and our advice is simple: Whatever diet you choose, make sure it does what you want it to do, and this is best ascertained by medical examination. A word of caution about diets and eating habits. We have dealt at length with the issue of fake drugs. Food preservatives are used in the food chain. Some of the preservatives could cause as much problems as fake drugs. For example, plantains, bananas, and oranges can be forced to get ripe by fermenting them with harmful chemicals such as carbides and oro. Carbides are also used to preserve grains, cassava, and yam cuttings, and there have been reported cases of death arising from the consumption of diets of grains, cassava, or yam cuttings so preserved. There are health hazards from the chemicals which are used to preserve frozen protein sources such as fish, chicken, and beef. Health hazards from preservatives are particularly worrisome in countries like Nigeria where nothing expires. I am not aware that a loaf of bread or a sachet of water or any food item has ever been destroyed in Nigeria because its shelf life has expired. We are aware of the fact that the elderly, at 65, is less physically active than when he was younger. So, he will require less of energy and protein-rich food, but he is advised to maintain the normal intake of minerals and vitamins. This is so because, according to nutritionists, the level of body function for which these latter components are required remains relatively constant with age. Again, research has shown that with advancing age, there is gradual loss of bone minerals and decrease in the water content of the body. The elderly people also have reduced capacity to digest large amounts of food, and this is probably why they tend to eat small quantity of food. However, while reduction in food intake could lead to inadequate supply of nutrients, reduced capacity to digest food could lead to constipation or feeling full. Reduced food intake and decreasing ability to digest large amounts of food are some of the variables that need to be articulated in the diet for graceful aging. We note that eating habits vary in terms of how much food to eat and when to eat. Some people prefer light meals for breakfast, while some others skip breakfast and eat heavy meals for lunch. As for dinner, habits vary a lot more than for breakfast and lunch. That regular or extra drink makes a lot of difference. Some people may be so full that they forego dinner. For some other people, a cup of tea will do. Also, for some people, meal times are not critical, and for some others, especially those who are on medication, meal times are critical and must be strictly adhered to. For a healthy eating habit, the advice is to have about 5 hours between meals in order to give the digestive system enough time to do its work. There are occasions, such as those of long meetings or interviews, when these intervals cannot be maintained. Snacks are then used as stopgaps. Another advice for healthy eating is to take one's time over meals rather than rush through them. My observation is that people from busy or city environments are almost always in a hurry to get done with their meals. I wonder how much enjoyment such people derive from eating. We note that when time is taken over meals, the food spreads over a big stomach area, thus simplifying the work of the digestive organs. The spectrum of guests at social events is broad. There are the special guests who must be taken proper care of, there are the others who are served normal rations of foods. During social events, we talk about feasting, and only a few people maintain a semblance of the eating habit which they had formed. For the vast majority of people, social events provide the opportunities to eat the foods and have the drinks that they do not normally eat or drink, or cannot afford on their own. Salads and wines are examples of such foods and drinks. Some people also tend to eat too much at social events. There are the uninvited poor who eat whatever is available and who also take home leftover foods. I feel very uncomfortable about wastage of foods at social events. When guests are seated, it is assumed that they are hungry, that they need food. For some of the guests, the food rations are too big. Some guests may not like the food that they are served and do not reject such foods, because they do not want to be seen as choosy or disrespectful to their host. So, they take a bite and abandon the remaining food. Eating too much at social events, like fasting as prescribed by the religions, has one thing in common: the digestive system is periodically abused. At times, the system has too much work to do, and at times, too little to do. There is also a great deal of discomfort with overeating. There are probably some spiritual rewards for fasting, but I do not know of any benefit of overeating. There are harmful health implications for fasting or overeating, and I avoid these practices. The eating habits of some people include the indiscriminate use of vitamins and mineral supplements which abound in the market. I do not use food supplements because I am not sure of the benefits that I will derive from them. Consider the following. We get our vitamins and minerals from the food we eat. When we eat a carrot for vitamin A, the carrot contains more than just vitamin A. It contains other constituents that may well interact with the vitamin A, and in the process help to deliver it to the cells of our body in a more helpful and efficient way than through vitamin A tablets alone. This is one of the reasons why nutritionists advise that food groups do more good than dietary supplements. The value of food supplements for the elderly people and how much is needed are issues that must be considered, bearing in mind a word about how much vitamin the body requires discussed earlier. There is another point of interest, and this is about the role of breakfast in health. Some people say that the body that stayed all night without food deserves a good breakfast to start the day. So, they recommend that we should eat like a king in the morning, like a prince in the afternoon, and like a pauper in the evening. But with changing patterns of work, one wonders how much time there is to prepare a king's breakfast before the beginning of work. I have personal experience in the areas of reduced food intake and decreasing ability to digest foods. My strategy is to eat small meals at a time and top up when necessary. Exercise. Exercise and diet feature prominently in discussing health matters. They are regarded as the most important preventive maintenance for the body. In Nigeria, the business of fitness and exercise centers is growing at a fast pace because of the growing awareness of the positive relationship between exercise and fitness. It has been established for a long time that the words fit and healthy are linked. The elderly person will have no problem understanding that the questions "how fit are you" and "how healthy are you" mean the same thing. For centuries past, many people in what is now known as the industrialized world engaged in hard manual work. However, with advances in technology and changing patterns of work, there is not much of the physical exercise which was part of the manual and laborious work of the past. Modern work patterns have led to sedentary lifestyle with serious consequences for health or wellness. The state of a person's health or wellness can be assessed by how much physical work that person is able to do. Physical work in this context goes beyond manual labor as it was known in the past, or the labor of low-class workers such as hustlers, haulers, cleaners, and peasant farmers as we know them in the developing world. Physical work includes all movements. The activities in breathing, eating, sitting and standing, and walking are considered as physical work. However, from the standpoint of fitness, physical work implies vigorous exercise. Our health condition can be improved by physical exercise. The exercises the muscles do increase their need for oxygen. During physical exercise, a person breathes more deeply to get more oxygen into the lungs. In the process, the heart beats harder and faster to pump blood to the muscles, including those of its own. The more the muscles are worked and the larger the number of them involved, the greater the physical gain. The cardiovascular system is said to benefit the most from physical exercise of the dynamic type, such as walking or jogging, because, in the process, oxygen inhalation increases. The end result is the reduction in the risk of heart disease. As a matter of fact, studies show that people who walk consistently develop fewer illnesses than people who are sedentary. According to Awake. 2004, the Greek physician, Hippocrates viewed walking as man's best medicine, while he recalled the adage which says, "I have two doctors, my left leg and my right." Exercise is done to strengthen the back, the spine, and joint muscles. Other benefits of exercise include increasing the body's ability to use insulin, thus fending off diabetes, keeping bones strong, thereby reducing the risk of osteoporosis, and supporting weight maintenance, especially for those who are on the borderlines of body mass indices. We also note that after exercise, many people sleep better, wake more refreshed, become more alert and are better able to concentrate on what they are doing than before the exercise. Many types of exercises, which include neck rotation, beating the imaginary drum and press-ups, can be carried out on the bed, in the living room or within the premises of a house. There are the Keep Fit series of exercise, there are the others designed to relieve pain or to reduce weight. The advice is to do some strenuous exercise 3 times a week. But the question is, how strenuous is the exercise, and the answer depends on many factors such as age and health status. It helps to consult a doctor for the evaluation of health status and advice on suitable types of exercise. The professional fitness and health centers have what they call the essentials of a good exercise program. It might also help to use their services. Physiotherapists, too, are in a good position to help in designing an exercise program. The elderly people need to watch it, though. They do not have to exercise to exhaustion. We note that the health benefits of walking are many and attractive. Ironically, the exercise of walking entails a lot of hazards in many countries where there are no walkways. For example, one could get knocked down by other road users such as motorbike riders, or one could stumble on any of the many potholes that typify the state of road maintenance in these countries. Tobacco. There has been some measure of controversy about smoking. Some people claim to be more relaxed during and after smoking, others do not see any benefits in smoking. However, scientists have, for a long time, established a link between smoking tobacco and the development of life-threatening illnesses such as lung cancer and some form of heart disease. Thus, governments in many European countries have banned smoking in public places in order to discourage smoking. At corporate levels, almost all airlines have banned smoking in their terminals and on their flights. Hotels have also banned smoking in their lobbies. In Nigeria, there is a paradox about tobacco and smoking. While the federal government warns that smokers are likely to die young, the same government gives license to companies to manufacture cigarettes. This is akin to saying, here are cigarettes for you, but smoke them and take the risk of dying young. Some of our friends have argued that the cigarettes produced in the country are mainly for exports, to earn money for the government. So, what is not good for the goose is good for the gander. What an irony. Let us examine cigarette smoking as a potential enemy. Tobacco affects the blood circulatory system in the form of constricting the blood vessels so that less blood flows through them, resulting in a number of health risks such as high blood pressure, cancer of the lung and the larynx. Consider, for example, the constriction of the coronary arteries. Less blood will flow to heart muscle, thus increasing the risk of heart attack. Some smokers develop a kind of chest pain which doctors call angina. Smoking is known to cause an increase in the rate of heartbeat. The more heavily a person smokes, the greater the risk of heart problems. This is so because the workload of the heart is increased, causing a more rapid wear and tear of the heart. In all of these, experts say that most heavy smokers die 7 or 8 years earlier than those who do not smoke. Pipe smokers are not many in Nigeria, but few as they are, they need to be aware of the risk of cancer of the lip, mouth and palate. In the rural areas of Nigeria, it is common to snuff tobacco. There is the risk of cancer of the cheek and mouth in this practice. There is no longer any doubt that there is a lot of risk in smoking. So, if you smoke in the comfort of your room or where smoking is allowed, you may want to give it up now. We have no doubt that an adult who is interested in, and is serious about, graceful aging usually finds a way to overcome the habit of smoking. Alcohol. When friends get together for a drink, it is usually cheers, good luck, good health at the start and one for the road, towards the end of the get-together. The drink we have in mind, be it beer in the form of light or dark ale, wine, liquor or spirits, contain alcohol. Alcohol is a drug and a potential enemy as well. There could be some benefits from having a drink containing alcohol. Such benefits are attributable to a gradual dulling of the brain and nerve. 1 or 2 drinks act as a relaxant, much as some tranquilizers do. And what is the measure of a drink? The information we have about a drink varies from a broad description to specific values. For instance, Professor Ketiku describes one drink as 5 fluid ounces, 150 milliliters, of wine or 12 fluid ounces, 360 milliliters, of beer or 1.5 fluid ounces, 45 milliliters, of liquor. The British Heart Foundation, BHF, talks about a unit of alcohol being equal to half a pint of ordinary beer or a small glass of wine or a pub, drinking house, measure of spirits. The alcohol in wine could vary from 10% to 14.5% by volume. Similarly, the alcohol in beers and spirits vary. So, what is the precise definition, if any, of one drink? I had some drinks during one of my travels. A 187 milliliters of wine, which contained 14.5% alcohol by volume, was said to constitute 2.1 units of drink. Another type of wine, 187 milliliters at 12.5% alcohol, was said to contain 1.8 units of drink. I used these figures to calculate the volume and alcohol product of a drink, and I arrived at an average of 1,295. So, if I need to have a drink, I do a simple arithmetic to assess my intake. According to BHF, moderate drinking, between 1 and 2 units of alcohol has a protective effect on the heart of men aged over 40 and women who have been through the menopause. But alcohol becomes an enemy if consumed in excess or if it is misused. The three common forms of alcohol misuse are hazardous use, harmful use, and dependence. Hazardous alcohol use is defined by the World Health Organization as a pattern of alcohol consumption carrying with it a risk of harmful consequences. Hazardous use focuses on drinking more than the limits set by law or health authorities. For the purpose of this discussion, we will use excessive alcohol consumption for all the three forms of misuse. There are social, economic, and health implications for excessive alcohol consumption. Let us examine the health implications. Most alcoholic drinks contain ethanol, a neurotoxin which is a substance that can damage the nervous system. The body is able to deal with ethanol slowly, over a period of time. So, if alcohol is consumed at a faster rate than the body is able to handle, enough ethanol is built up in the system and begins to interfere with brain functions. Interference with brain function is characterized by incoherent or slurred speech, poor vision, and loss of balance. In a similar action, prolonged and excessive consumption of alcohol may damage the liver. For a start, inability to handle ethanol slows the digestion of fats, causing them to build up in the liver and, consequently, we have fatty liver. According to medical experts, severe inflammation causes liver cell to burst and die. The final blow of alcohol on the liver is what the medics call cirrhosis. We are told that the vicious cycle of continuous inflammation and cell destruction cause irreversible scarring, and, eventually the liver becomes lumpy, instead of remaining spongy. In all of these, the normal flow of blood is impeded, resulting in liver failure and death. In order to emphasize the point that we are into experience sharing, I recall that my brother died of cirrhosis of the liver at age 50. During his time, the most popular drink, next to palm wine, was the homebrewed gin, known by such names as Agogoro, Apatisi, Push Me I Push You, or, simply Hot. The homebrewed gin was made from palm wine, was readily available and was cheap. Therefore, it was usual for many people to drink as much as they wanted without being aware of the implication of excessive alcohol intake. In order to discourage people from drinking the homebrewed gin, emphasis was placed on the harmful effect of the impurities therein rather than the ethanol in the alcoholic drink, whether homebrew or imported. Let us move on to look at the effect of excessive alcohol on the other organs of the body. Alcohol increases the risk of cancer of the mouth, the pharynx, the larynx, and the esophagus. These parts then become vulnerable to cancer substances in tobacco, thus posing a higher cancer risk for smokers and those who snuff tobacco. You can see why the marriage between alcohol and tobacco is unwholesome. The stomach itself is at risk of chronic gastritis from excessive intake of alcohol. The heart has its share of problems from alcohol misuse. According to medical experts, heart muscle becomes weak and may eventually be damaged because of lack of essential nutrients, which should come from the food that heavy drinkers forego. Heavy drinking causes the level of sugar in the blood to fall rapidly. Under this condition, the drinker feels weak, dizzy, confused, and abnormally hungry. We have observed that excessive alcohol consumption also tends to increase sexual desire while decreasing the ability to maintain erection and sustain performance, possibly because the alcohol dulls the nerves that control erection and ejaculation. As for women, a pregnant woman may damage her unborn child if she drinks heavily during pregnancy. It is sufficient to note that in excessive alcohol consumption there are enormous socio-economic risks for self and for others. There are problems at work, there are problems with family and friends, and there are problems with the law. Nuisance value in the form of antisocial behavior could increase. So, if you drink alcohol, do it in moderation. We are aware, however, that some people find it difficult, indeed impossible, to confront the potential enemies of good health such as giving up smoking and reducing alcohol consumption. They argue that something will have to kill someone, so why not enjoy that which you can afford? A side of the argument that is overlooked is that if a smoker comes down with lung cancer, or a person who drinks heavily comes down with liver or heart problems, that person is not only killing himself but also tying down, through his medical and social care, resources that could have been used elsewhere. Repairing the damage from tobacco and alcohol. If we have had a good time with tobacco and alcohol in our heydays, is it too late at 65 to put our vehicle on reverse? In other words, can we, at 65 and above, benefit from giving up smoking and alcohol abuse? The answer is yes, because a vast amount of scientific data shows that the body has an amazing ability to heal itself, provided that the underlying damage is not too great. There is also the finding that the damage done to the lungs by smoking tends to last longer than the damage done to the circulatory system. Research has shown that while giving up smoking can eventually restore the lungs to their original bright pink form, it does not necessarily mean that all the cells deep within their folds are now healthy. The Time magazine of February 2001 reports the following results from medical research to support the foregoing claims. Laboratory measurements show that eating more fruits, vegetables, and fiber changes the blood sensitivity to insulin within 2 weeks, helping decrease the risk of diabetes almost immediately. Sedentary 40-year women who start walking briskly for half an hour a day, for days a week, enjoy almost the same low risk of heart attack as women who have exercised conscientiously their entire lives, and when smoking is stopped, the carbon levels in the body drop dramatically. Within a week, the body becomes less sticky and the risk of dying from a heart attack starts to decline. 4 to 5 years later, the chance of a heart attack falls to nearly the same as that of someone who has never smoked. As for alcohol, we note that the liver and the brain are the most susceptible organs to the harmful effects. Research has established that, contrary to popular belief, the liver does not always regenerate itself, more so if cirrhosis or scarring has developed. And, with the brain, if alcohol abuse gets to the level where it masks mental illness, say depression, repairing the damage may involve treating the underlying mental illness. Repairing the damage done to our body goes beyond adding extra days to life, it includes improving the quality of our life. Where to start the repair is no big deal. Anywhere will do because, as they say, one positive change will lead to another. Yes, we should avoid that which we can. Luckily, I have been sufficiently constrained not to have smoked and not to have had one drink too many. Much more, I find it uplifting to have good and sober people as friends. Friends who have either given up smoking or have never smoked, and friends who do not believe in having one for the road. Remember, whatever your situation or your surroundings, all you need to keep in mind is that when all is said and done, your choices are always yours to make, not society's or your friends. So, stay safe, make good decisions about the company you keep, and take each day as it comes. That concludes today's episode. We sincerely hope you found the information insightful and practical. Stay tuned for our next episode, where we'll be delving further into the retirement and graceful aging journey. Until then, take care of your mental health, and stay positive.